According to Ethiopian standard, on has 80,000 to 100,000 should have one primary health care.
UNFPA Ethiopia is delighted to organize this donor visit to Somali region. We have with us 6 donor countries. We have Portugal, Spain, Netherlands, Japan, Sweden, and Denmark. And we'll have the opportunity to meet the authorities of Somali region, the president and his team. Through this field visit, we also have the participation of the UNFPA Regional Director for Southern and Eastern Africa, who is with us, which really makes it a very important one.
These meetings have been very useful in enabling myself and my country office to better understand what are the needs, where are we making impact, but also where we can do more.
Organizing livestock, the job creation. This took the bulk of our budget. So naturally, we feel the very important protection-related issues have not been given the attention they require.
In the last few years, United Nations Population Fund has supported in Somali region over 400,000 women and girls to access the full range of reproductive and sexual health services.
I'm very glad to meet all of you in terms of supporting us on other types of help.
Work by UNFPA, it's quite good. I was amazed, especially at the General Hospital in the Karamata, where despite all the challenges and maybe the reduced means, I saw the willingness of the staff, the doctor, the nurses that were there. I think it's very important to go to the field to have a good grasp, a good knowledge of what's happening outside Addis Ababa.
This field visit with other donors that we are supporting UNFPA is a good opportunity to know in the field the work that is promoted by UNFPA together with the regional government, the federal government, of course, and other institutions.
I think it's clear to see what the contributions have been, what the results of the work that UNFPA has been doing, and also the Danish support. But I think also the challenges are very clear in this region. Most of them relate to resources. I was very happy to see the acknowledgement of the complexity of the issues here, of the situation, and also the complex solutions.
And I'm really impressed, and I have a lot of respect for all the young people and for all the doctors and the medical experts, the nurses that are working in the hospital on pretty difficult conditions. We see how intense the needs are, how huge the needs are.
The one-stop shop that we visited were under one roof, professionals, sometimes very stretched, limited numbers of professionals, still gave space for women to be, and children, by the way, to be addressing the matters which are of a very grievous nature.
I've been very impressed by all the work that's going on here. We're seeing positive developments across many indicators. Secondly, we are seeing developments that are coming from very low levels. So this is a region that has had many challenges over the years, but the positive development is coming around.
It will give us the opportunity to see firsthand the needs of the people we serve, and at the same time see how we are responding to those needs.
UNFPA's work here in working with partners and really seeing how phenomenal the work that they are doing in health clinics, in voluntary women's associations, in hospitals, and how wonderful results that can have when they are working with your support and in collaboration with UN agencies across the board.
We had a very good engagement with the youth who were very interested in sharing the scarce resources that they had in IT, sharing one computer with 2 or 3 and many of them ladies, girls. I think it was very interesting to note that. But also one center for self-teaching, where books were available for persons who were seeking to advance their education. And again, I was pleased to note the presence of very interested young ladies, conscious that it's in their hands to change their future.
I could see so much potentials in the Somali region, and I could see why the UNFPA is eagerly engaging in this region.
The needs are vast. The facilities that are there are insufficient to cater for the needs of these women and girls, and to ensure that we can reduce maternal mortality and morbidity, prevent teenage pregnancy, but also respond appropriately to gender-based violence incidences.
Now we are on a mission together with UNFPA, which is an important partner from the Netherlands when it comes to sexual and reproductive health and rights and the fight against gender-based violence.
We are very happy to consider seriously regarding as a donor for the commitment for this region.
As community of donors, this is an opportunity to exchange experiences, to exchange feelings and different approaches, and to encourage all the community to continue investing in the programs that UNFPA is promoting in the country.